मेरे में भी नहीं दिखा।
Now you can mute yourself. Okay. Why we are not able to go back or something like that? What is happening? Okay, so I think now I'm going to do the screen sharing. The screen is visible now. The screen
Yes,
is
sir. Yes, sir.
okay. So it will be more of a pictorial presentation than anything else, and I hope few of you might have seen it on SlideShare or not. So we say it is a lecture which should be taught to you when you enter into medical college. But anyways, once you have not even there and nobody has talked about it, of course, few of the things are taught to you in the Department of Community Medicine, but then we'll be continuing. So what are the various functions of a doctor, and what are the attributes which are required to become a successful and a very good doctor? That is the objective of today's lecture, right? So we'll be going through very slowly, and it will be much more interactive, and all of you will have to participate. So what are the functions of a doctor, basically? What do you think? What are the various functions a doctor has to do? Yes, anyone?
Sir, treat the patient.
Yes, absolutely correct. Anything else?
So be compassionate towards the patient's condition
Okay.
or the disease.
Okay, that is not a function, that is an attribute, basically. What else? Anything else? Okay. So we say in this COVID pandemic era, a doctor is a confused person because he has to do all the things. There are so many guidelines which are coming in, and he not only have to treat, but then he has to do a lot of data collection. He has to manage the whole team, right? And he has to provide a lot of teaching and training also. So that is what is required. So we say that a doctor first function is to heal the patient. That is for any specialty, for any doctor, that healing is the most important aspect. But here you will have to understand, and you will have to keep this thing in your mind, that healing is done by the body itself. Doctor does not do the healing, it helps in the healing process. Like if a patient comes to you, you diagnose, you treat, but then ultimately healing will be occurring through the body, through the mind of the patient. That is why we say mind body connection is very, very important as far as the healing is concerned. So in other words, we can say the first function of a doctor could be treating. Treating the doctor is could be the first function. Treatment is the first function, and for treatment you have to have a good knowledge regarding history taking, regarding examination, doing examination, and regarding making a differential diagnosis, and then diagnosing, and then you should know what is the most appropriate treatment for that particular disease. So that is the function number one. Now we go to the next. The second function is the doctor has to teach. The doctor has to teach, because, and for teaching, what three things are required? A communication skill is required. Number two, a counseling skill is also required. because at times you will have to listen to what people are saying, because majority of time we think then whatsoever we are saying is easily understandable by each and everybody, and there may be some kind of difficulties. So you have to be a good motivator as well as a good counselor. And education, when we say, again, education is a word which is majority of time is very, very poorly understood. Majority of time we get confused between information and education. Like today, I am teaching you, I am just right now, I am just giving you the information. If this information is converted into action, then we say that yes, you are educated. If this information is not converted into action, then it remains only the information. So the first function is treatment, second function is teaching and training. And for this, communication skill is very, very essential part, as well as a counseling skill is also required, so that you have the attention as well as you have the faith of your students. That is important. So what if the faith is not there, if the students doubt you, then it becomes difficult for them to comprehend what you are saying. And moreover, whatsoever you teach, then that knowledge is to be translated into action. Then the third function of a doctor is the doctor is the leader. Doctor is the leader. He is the leader of the health team. Like in COVID era, you must have seen that it's a teamwork. Whenever you are treating patients, then there is a whole plethora of the workers. If you are a consultant, if you are a junior doctor, then there are interns, then there are nurses, then there are paramedical workers, then there are sweepers, right? And ultimately, end of the day, all the responsibilities is
అలవాటైపోయింది 2020 అలవాటైపోయింది
doctor,
మళ్ళీ టైం పడుతుంది
right?
2021 అలా
Doctor has to be the leader of the team. Number two, doctor has to be leader in the family as well as in the community, because you all of us understand that and we have given this definition also when I was doing my presentation, that who is a doctor? A doctor is one who treats the patient. Who is a good doctor? A good doctor is one. Kindly mute yourself, please.
దాన్ని మూలంగడ్డ అని
A
కూడా
good doctor is one who is
కందగడ్డ
not only treating but able to prevent the occurrence of disease in others. Excuse me, there is somebody who is talking. Please stop it.
దానికి ఇంకో పేరు అంటారు పెళ్ళిళ్ళకి కూడా తీసుకుంటారు
Somebody is talking. Please stop it.
Sir, this is Dr. Ellen Enki. When is she?
What can I do?
Sir, you could mute all of us from your part, sir, as a host.
Okay, then let me try to do that. Then for that I have to mute. Mute. So more. I have not, because there is a lot of confusion. Anyway, now it is silent. So we were talking about the doctor's function. Basically, the first function is that he has to treat. Second function is he has to teach. And third function is that doctor is the leader in the community. Because that is how the politics goes on. You must understand, now whatsoever decisions are taken, if the leadership is lacking, then all the decisions are taken by the politicians. So public health is nothing but medicine at a large scale only. So you'll have to understand that you have to lead the community wherever you are working. Okay, so you not only have to lead the health team, but you will have to lead the community also, and that leading by example is the best thing. And we have seen number of times, and this usually happens, we have seen doctors smoking and advising patient not to smoke, and then if the patient asks why do you smoke, then either the doctor does not have a scientific answer or gives a funny answer. I am a doctor, I know what to do and what not to do. So this is not a right kind of a answer. So you have to lead by example. And if you are providing education to the people, especially you are providing preventive education to the people, then you have to indulge yourself. It should not be like that your BMI is too high and you are asking people to lose weight. It should not be like that your BMI is too less and you are asking people to gain weight. So both the things, both the ways. So your behavior has to be absolutely in consonant with what you are going to teach or preach, right? And you have to lead by example. So these are the basic three main functions. Now, how to acquire these three functions? You must understand knowledge is one thing for which the medical colleges are there. But then there are number of attributes which are there. There are number of attributes which has to be there, which not essentially that everybody will be having those attributes, but as and when you grow in medical education, as and when you grow in practice, gradually you will start developing those attributes. Now this part, what we have discussed today, you may find it in books. Now the next part which we are going to talk about, the attributes of a doctor, what qualities a doctor must have, is not written anywhere. So this is all based on my experience, and I'll be making it more interactive now, right? So what are the various attributes? And we start with first. Now, what does this picture tells you? Anyone?
That we should not be shouting.
You should not be shouting. Okay. Anyone else? So this is the first attribute. This is the first attribute, and this tells you that a doctor has to be disciplined. Discipline is of utmost importance. And if all of you have become doctor by now, and you are doing your post-graduation, you must be clear in your mind that if you are not disciplined enough to do your studies, if you are not disciplined as far as your timing is concerned, if you are not disciplined as far as your learning is concerned, right? So discipline is the first attribute. Why it is important? You see, when we talk of life and death, how much time is there? So say in case of a newborn, it's only 1 minute. In case of adults, golden 1 minute, we say golden 1 minute is there where you can revive the newborn, right? And for adults, we say it's a matter of 4 minutes. So if you are not disciplined and if you don't follow the timeline, then if you are late, then it could make a difference as far as the life and death of any patient is concerned, right? So discipline is the first attribute. Now let's go to the next one. Of course, it is already written here in this picture. The second is dedicated. You should be dedicated. Dedicated towards whom? Number one, you should be dedicated towards yourself, that you want to become a good doctor. Number two, you should be dedicated towards your education. Number three, you should be dedicated towards your patients. Number four, you should be dedicated towards your community and your families. Because you have to understand, without this, if you are not dedicated, then what will happen? You will never put patient on the priority. You will never put community on the priority. But your priority as a professional is the patients and the community. So if you are not dedicated enough, then why the community will consider you good? And what is the definition of goodness? Everybody says that he or she is good. No, but the definition of goodness is when people say that you are good. And people will only say you are good when you are dedicated towards your work, towards your patients, right? So this will have to develop. You can't, you have to leave everything. You have to leave everything. And this, there will be number of examples which can be given, right? As far as the patient is concerned. Because if a doctor start operating, say, if a doctor is a surgeon, he starts operating at say 11 a.m. in the morning and his duty finishes at 2. and the operation is not complete by 3 p.m. or 4 p.m., is he going to leave the patient in between? He can't. So you have to understand that that much of dedication is required. Or if some important function is going on in the family and you are supposed to be present for the treatment of another patient, what will be your priority? You have to miss your function because you have to be dedicated towards your patients. That is the attribute number 2. So I always say medicine is a very, very difficult subject, and if you want to practice medicine, you have to lose a lot. And I can share you personally so many examples where we have missed the weddings of nears and dears. Even I have to miss the engagement ceremony of my brother-in-law just because of my patients. So you have to do that because you can't put anybody upfront in place of your patient. So dedication is number 3. Then what is this picture showing you? Can anybody tell me? Again, the words start with D.
Devotion.
Yes, absolutely correct. So you have to be devoted. Again, dedication and devotion. Like you believe in any religion and you are devoted towards that supernatural power, whether you call it God, Khuda, Allah, Jesus, whatsoever, you are devoted. Everybody in the community, people are too much devoted. Similarly, as a professional, we should be devoted towards our work. And we should leave everything behind. And you can find enough number of example in your own families, especially if your mother is too religious, then what she does in the morning, irrespective of the weather, irrespective of the temperature, if she has to perform some certain ritual in the morning, she will do that, right? So similarly, a doctor has to be devoted, and he has to be devoted towards the patient, towards the education, towards the teachers, towards the colleague, right? This devotion is required in all the areas, whatsoever area, towards the community. If there is a problem, who is going to solve the problem? Because you have to remember, one of the function of a doctor is a leader, and people always look towards leader whenever there is a problem. So you have to be disciplined, you have to be dedicated, you have to be devoted, right? Then again, this is a picture. You can see this is a very good picture. This is a small person who's fighting with a big height, right? Determined. You should be able to you should have a very, very great power of determination. And this is required whenever you are dealing with. So behavior change communication, when we say, as far as our subject is concerned, when you go to the field, then you come across resistance. And I can share the example of the pulse polio. And you will be facing this problem now again when this good news of COVID vaccine has come up. The government has given this emergency use, and gradually it will be used for the masses. You will come across a lot of resistance. People will not accept the vaccine. And you can't then simply come back and say, okay, people don't expect what we can do. You should be determined to change their attitude and behavior. And you have to find out the examples how you can do it. You have to have the good and sound knowledge. I can share with you. In 1997, it's around in 1997 when this intensified pulse polio immunization program was launched, and I was nominated by the government of UP to work for Meerut district. And in Meerut district, there is a village by the name which is in the Jani PSC, Jani Kala. And Jani Kala village was peculiar because in last 3 years there were cases of paralytic poliomyelitis, meaning by in 94, 95 and 96, 3 continuous years, there were cases of paralytic poliomyelitis reported. So the government of UP requested the medical colleges, and they requested us to tackle this problem of poliomyelitis in that particular village. So there was a process which was known as a process evaluation system, And we worked in that village for 6 months with the workers. And there was, it was a total one religion village. It was a total Muslim village. And the peculiarity of the village was like this, that there was a lot of marriages inside the villages which were happening. So the Maika and Sasural was all there. And there was enough number of children. There was a lot of problem of poor sanitation. And we met with lot of resistance. And the medical officer of that particular PSC used to say me that we have to call police to go for pulse polio immunization. So I used to say, no, nothing. We will explain the people, and we develop our own language, and we started working in the village. We used to have total round of the village, and gradually people started accepting us, and then we could completely immunize the village. And till that date, from 1997, there is not even a single case of poliomyelitis in that village. Of course, 3 years back, we were declared as polio free. So you can imagine for 20 years, there was no case of poliomyelitis in the same village, because we were determined, the workers were determined, and we did not use any force, right? So you have to have a determination that you are going to do it. Similarly, when you treat a patient inside the hospital, right? There may be a lot of problems there, but yes, you have to tackle all those problems, and you have to go for the benefit of the patient. Then the next, now what is this? Anybody can guess what is it? What this picture is telling you? What another word from D comes to your mind? Anyone?
Diagnosis.
Yes, it's not diagnosis, it is duty bound. Duty bound. You are bound by your duty. You are bound by your duty, right? And I'll tell you a very emotional story, which is a true story. Um, and this is a story of a corporate hospital. One young adult was suffering from pain in abdomen, and he was taken to a corporate hospital where he was diagnosed as suffering from acute appendicitis. And the person was in great pain, and the team made the diagnosis, and they were waiting for the surgeon to come. Of course, the surgeon took some time to reach to that hospital, and before talking to the attendants of the father of the patient, um, the doctor straight away went inside the OT and operated the patient, and then came out and simply said to the father that the operation is successful, and then went away. Because it's a story of a corporate hospital and everything is paid. So the father of the young adult was furious, that because of few reasons. Number one was that this doctor came late. Then he performed the surgery, and then simply gave one sentence that the operation was successful and went away. And he started shouting, right? What is it? And they charge so much of money, and they don't have time to talk to us. They come late, and they don't have the humanity, and this and that, and so many things. So everybody was listening very patiently to the outburst of that particular individual. And when he bit settled down and calmed down, then the team members of that particular doctor told the father that, look, you do not know what is happening. The doctor who came and operated your son has lost his son in an accident, and he came directly from the cremation ground to operate your son. And you can imagine what would have happened to that angry father. So that is, you will have to understand, a doctor has to be duty bound. So you have to perform your duty, because if you are not performing your duty, then what will happen? The life of the people will be lost. So it is important, and you have to keep your composure. You have to be very, very calm, and you don't have to get excited for anything. You have to just perform your duty and move forward. So that is why this is another important attribute, and that is why I say you will have to keep the patient first. And remember other thing, who is the best teacher? Who is the best teacher? Your professor? No, your professor is not the best teacher. Your patients are the best teachers. The more you interact, the more you see, the more you learn. Learning by doing is the best thing in case of medicine. So your patients are your best teachers, and you have to give it back to the patients. Then this is another picture. Yes. What does it indicate? Again, the words start with a D. What it could be?
Direction.
Okay. This is decision making. You see, you will have to take a decision. There will be number of instances where there will be a lot of confusion, whether it is clinical medicine or whether it is a public health. Like today, if you have to decide now, and I can give you the example right now. We all of us know that emergency use authorization has been given to the use of vaccine. One way could be, one arrow which is showing here is, you can think, okay, why? We should remain in our safe bubble. We should not interact, and we should wait for some time. Or we should wait for another vaccine which has got a clear data. Right? But then you must understand, it's a pandemic which is going on, and we have already lost more than 700 doctors. What is the priority? Even if a vaccine is giving you 70% or 80% protection, right? Then your decision should be, yes, you should take the vaccine. Because if the vaccine is going to prevent the occurrence of severe kind of disease, you are going to prevent the occurrence of mortality. Right? So there is a lot of confusion right now, even in the mind of doctors, what to do. But then if you don't have the sound knowledge, that is the problem. There was a discussion which was going on, well, what should we do? Well, shall we keep a gap of 28 days, or shall we keep a gap of 3 months between the first and the second dose? So here I would like to clarify a few things to you. You see, whenever we talk of vaccine efficacy, there's a lot of confusion because the basics are forgotten again. Suppose we say the vaccine, first dose of the vaccine has got a 70% efficacy. What does it mean? It means that if you give vaccine to 100 people, out of 100, 70 are going to be protected. 70 are going to develop the antibodies. Right? Now, if you have a shortage of vaccine, then what you do is you say, okay, we have given it to say 100 people, 70 are protected. Now we give again the first dose to remaining 100 people. So 70 more will be protected. What is the job of the second dose? If we don't give it to say other 100 people and we persist with the first 100 people, we give to next dose to say all the 100 people, 70 have already developed the antibodies, 30 have not developed the antibodies. Now, if you give the second dose, then 70% of this 30 is going to develop the antibodies. Meaning by, you will be able to achieve what? Now, suppose you have 200 people to whom you are going to give vaccine. And if you give 2 doses to same 100 people, you will be able to protect 90 people. But if you give a single dose to 200 people, you will be able to protect 140 people. Right? So that is based on your scientific knowledge. So decision making will be absolutely dependent upon the clarity which you have got in your mind, that what is the correct and what is the most ethical, what is the most appropriate, what is the most cost effective method. You have to take a decision on that. That is the importance of decision making, and it requires a lot of analytical power. You have to develop this analytical power. That is why I say this is another attribute. And whatsoever decision you take, then you will have to persist with that. And then you'll have to persist with that. You can't keep on dithering. Another D, the dithering should not be the attribute of a doctor. Then a doctor has to be very, very dynamic. If we are living in a country which is a resource-starved country, we don't have enough resources. So you will have to develop the resources. And that is why we say you have to take help of the people. And you have to involve a lot of people in the healthcare delivery system, whether it is the NGO sector or other sectors or the corporate sectors. You have to take help. You can't say simply that I alone will be able to help everybody. You will not be able. So you have to be very, very dynamic, right? And you should be able to capture the resources. Maybe you will have to do at times what is, you might have to take more money from the rich people and then give it to poor people, right? That way. I've seen a lot of doctors, they do this thing that they see poor patient free, but they charge more amount of money from the rich patients. That is why, because they want to help the poor patients and everybody. That is what we say is, and this is what this picture again tells you something. Again, it starts with the word D. Dignity. When we were student, we were taught the ABC of the clinical practice. ABC of the clinical practice. ABC of the clinical practice. And what is the ABC of clinical practice? What is the meaning of A, B, and C? A is for appearance, B is for behavior, and C is for clinical competence. Right? So you will have to understand that a doctor must look like a doctor, number one. A doctor should not look like a hero. Like nowadays, we see majority of the young budding professionals, they follow Virat Kohli and Rohit Sharma and other actors, and they keep all this beard and all those things. Of course, this is not good in this pandemic era. What is there when you are wearing mask? So doctor should be looking sober. It should give a feeling that when somebody goes to a doctor, it should give them a feeling of peace, not the feeling of a glamour. So there should be a lot of dignity in not only in the appearance, but in the behavior also. And when we say behavior is very important. You always should have one ear. Speak less, listen more, because when you speak less and listen more, your behavior automatically becomes more dignified. When you lose your dignity, when you talk more, when you shout, right, then you lose your dignity. You must understand. So dignity is again very, very important. And take home this message: a doctor must look like a doctor. A doctor must behave like a doctor, right? And I would like to add here, when you become a doctor, everybody comes and says or addresses you as Dr. Sahab or Dr. Sahiba. Nobody calls you Abeo Doctor Idara. They are giving you that much of respect. And you must understand, if you want to get respect, then you must learn to give respect. So you have to be very polite in your behavior, and you should have an open ear. You should talk less, listen more. That is one of the characteristic of counseling also. You have to listen more, only then you can understand what people really need. And if you understand what people need, or what their conceptions or misconceptions are there, then only you will be able to take the correct action. Then let's go. This is what? Another D. Another D. This is another D. And this says that a doctor has to be direct. Direct means that you should be able to tell the patient directly, or the community directly, what is good and what is not good. You should not be diplomatic. You should not be diplomatic. You should not be diplomatic. Or you should not be dithering. Like I said, dithering is not a quality of a doctor. You should be able to, whatever you say, with your knowledge, with your existing knowledge, with your existing resources, whatever diagnosis you are able to make, whatever intervention you are able to make. Like I always give you the example of this big win intervention. And I fight for people. I fight with people because I say, yes, this is the correct thing. We have to have our focus below 1. Why you are asking me to focus under 2 or under 5 when we are not going to achieve anything? So I am direct. I'm not diplomatic, but I am direct. Right? Right? So you have to learn to this. But then direct does not mean that you start disobeying your seniors and your teachers. This direct in context of patient and community, not in context with your seniors and teachers, because you learn a lot from them. If the seniors and teachers would not have been there, then you have to learn everything yourself, which would have been very, very difficult. Whatever you are able to learn in 8-9 years, maybe you would have taken 80 to 90 years to learn, right? So direct does not mean that you insult anybody. You insult anybody. That is another attribute which we will have to keep. So then again, yes, this is another word with D. What it could be? What it could be? There are so many faces with so many expressions. Yes, a doctor has to be a good dramatist. Why it is important? Because you see, you are dealing with life and death, and you will be coming across a lot of emotions. Emotion of joy, emotion of grief, emotion of sorrow. And it should not be like this, that somebody has died and the team of the doctors are laughing. Right? At times, patients are brought in a critical conditions and you can't do much. But then, again, you should appear to be doing the best which is possible. Right? So this is one thing which you must inculcate. You must control your emotions. Meaning, I want to say this thing, that you should control your emotions. It does not mean that if something bad has happened, then you start crying. Crying is not going to solve the problem. Crying shows that you are weak, right? So you should be able to control your emotions in all the situations. And then we'll be talking more about the other attributes, then we'll probably relate with this attribute. Then, yes, another D is for doing. Doing means what? Yes, you will be always be doing your duty, and whether it is in relation to the clinical work or the managerial work or the data collection work. So you will be doing, and even if you are not doing, we have seen this number of times that doctors, those who are on duty, they are playing with their mobile phones. And that is how the problems arises. when the patients, they see that the doctor is not listening to their problem and is indulging in the mobile phone. That should not happen. That should not happen. When you are on duty, then you should be doing your duty, nothing more, nothing less. If you are studying, then you should be studying, nothing more, nothing less. If you are attending the lecture, then you must be attending the lecture, nothing more, nothing less. It should not be like this. I got a call in between and I have to attend the call. No, this is not done. And again, these are all attributes which are clubbed together: discipline, devoted, dedicated, doing, right? And so on. Then this is another one. Can anybody tell me what it could be? As is a clue is also already there. This is another word. This is detective. A doctor has to be detective, and this is true as far as the clinical medicine is concerned and the public health is concerned. Because whenever there is a new kind of illness, right, then you are asked to investigate. And your job is just like a job of a detective. So what does the detective does? He goes to the scene of crime and then look. He has to have a very good observation power and analytical power. Similarly, in terms of disease dynamics, you have to have a good knowledge, and then based on that knowledge, then you'll have to understand the channel of transmission of that particular disease, and then you will have to take action accordingly. So doctor's job is not only to treat, but then to identify the mysteries which are happening in the clinical and as well as in the public health arena, right? Then doctor should be definite. You should, again, be absolutely sure that what you know and what you do not know. That is more important. If you do not know about a thing, then you should accept it that I do not know. Maybe you have to go to next person. Maybe you have to go to a higher specialty, right? If you know, then you should be sure that yes, you know it, and you know all the things. You know the A to Z of this particular problem, and you will be able to solve it. Then we go further. We say a doctor should never be depressed. And depression is a very, very common word in the medical parlance. And whenever something goes wrong, something which does not happen as per your choice, then you say, this is a very common word which is used. Oh, I am depressed. No, you can't be depressed. That is why I said you have to be a good dramatist. You have to control your emotions. You should never be depressed. You get this life once, and once you have become a doctor, then you are in a best profession. You are in a best profession. And if a doctor gets depressed, and you must be reading a lot of things, a lot of people lost, a lot of JRs, a lot of young professionals, they commit suicide. Why? Your job is to treat the sick people, not to become sick. Your job is to prolong the life of the people, not to end your life. So you are not allowed to be depressed. And whenever you may feel down, then you must understand the human anatomy, understand the human physiology. You see, this human body is the best optical illusion. If you read more about the mythology part, the science part, right? Like I'm showing you my hand, all of you are able to see this is my hand, but in fact, this is not my hand. If I put this hand under a microscope, what will you see? You will see a cell only, right? And cell thrives only on energy, right? Cell thrives only on energy. So human body is the optical illusion, the biggest optical. We are all bundle of energies. And we have a purpose which is given to us. We have to identify our own purpose. Everyone has to identify his or her own purpose, and then you have to move forward. Once you have joined medicine, then your first function was you have to heal people. And when we say you have to heal people, meaning by if you are not going to heal yourself, how can you heal others? So there is no choice, no question, nothing. That is why I kept it deliberately here, that this should be kept here, because a lot of young professionals, when they are under stress, when they are working, they are not getting holidays, they are not doing anything. So what? Your time will also come. You will get everything. Control your emotions, perform your duty, consider you are duty bound. The more you will be working, the more experience you will be getting, and the more experience you will be getting, the more better doctor you will be becoming. Right? So take home this message that you are not allowed to be depressed at all, irrespective of circumstances, and we'll talk more about it. Right? So that is why there is a big cross here. Right? And this is the phenomena. So you should always be smiling. Have a little smile on your face, and this will eliminate a lot of suffering from the mind of a lot of people. Right? So you should never be depressed. Then you should be dogmatic. Again, you should be very, very convinced, or you should have a strong conviction that this is going to work and this is not going to work. Right? Even in today's pandemic, people are talking about, and when I took this lecture on COVID, again, I told you that yes, for what we are waiting? For the disease to go from mild to moderate and then we'll start treatment. No, we should start treatment as early as possible and prevent the patient from going into the moderate category. And we have to use the cocktail of the drugs. So that kind of a dogmatic approach is required. Only then you will become a good public health professional. Then you have to de-stress others. You don't have to give stress, but then you have to de-stress others. You have to de-stress others. Don't get stressed by the amount of work, the amount of duty hours. If you want to achieve greater things in your life, if you want to have satisfaction that yes, you have done something good, then there is no shortcut to hard work. And this is one field, again, I say, medicine is a very, very tough field. Of course, if you know how to do your time management, you will get time for everything. But then the other thing is that when we said there are three functions: healing, teaching, and leading. And who is a leader? Who is a good leader? A good leader is one who helps others. Then how can you help others? When you are strong enough. How can you help others? When you are rich enough. And how can you become rich and strong? This all based on your acquisition of knowledge and skill. You are young, your body is strong, your mind is strong, your brain is strong. Use it to the maximum possible potential. Work hard and don't get stressed if you are not getting time to do your personal or family work. Everything, you will get everything. You will get everything in life. If you start slowly, keep on building, you might have to sacrifice your sleep. If you ask me, I was a pediatrician, and till the age of 42 years, I never slept for more than 4 hours a day. Right? So you don't have to get stressed, you have to de-stress others. And it's a very, very difficult profession where, I can understand at times a lot of internal turmoil is going on when you are treating a lot of patients and other things. But then you don't have to show the stress in your mind. You don't have to lose your cool. Then, yes, doing good deeds, you should organize camps, go to the field, go to rural area, maybe join with people, see the poorest of the poor, where the services are not available, try to provide them the services, whatever services you can provide, right? So, or help others, do some charity, strengthen your own system, strengthen your own departments, strengthen your own colleges, make your own associations, make your alumni associations, and so on. There are a lot of things which you can, if you join hand, you will be able to do wonders. Remember, हिंदी में कहते हैं ना अकेला चना भाड़ नहीं फूंक सकता. So if you join hands, then you will be able to do wonders, right? So this is, then yes, now from D we come to a few, 2-3 more attributes, and then we'll be going forward. Yes, a doctor has to be sensitive, has to be very, very sensitive. Sensitive towards the needs of the people, of the community, of the patients' requirement. And that is why I said in the beginning that you should keep your ear open. Talk less, listen more, observe more, analyze more, see what is required, and do whatever is possible. Keep the sensitivity, help the poor, charge more from the rich people. There is no harm in doing that. We are living in a world where there is a lot of inequity, and this inequity cannot be eliminated by anyone. We have to play our part. So those who cannot afford, yes, you have to provide. And that is what is happening in our country, you see. If you look at the Ayushman Bharat, to whom this benefit is provided. This is being provided to those who do not have anything. People below poverty line, they have been provided the cover. And how the government is providing these beneficial schemes to poor people. They are taking taxes from the rich people and giving subsidy to poor people. That is how the society keeps on going on, moving on. You can dream of a world where there is equity, but equity and equality, probably these are the very, very difficult terms to achieve. Of course, we say that there should be equity and equality in the healthcare delivery system, but still no country in the world has been able to achieve it. And it'll remain a mirage. But then, yes, one has to try hard. One has to try hard. And for that, a sensitivity is required, right? Then, yes, you should be empathetic to the need. You should be able to understand the gravity of the situation. And you can always say that, yes, I understand what you are facing now. That is what is the empathy. You understand the other people's distress, difficulties, and then you decide to take action. At times, you will be facing this even in the field, even when you are treating patients, even at that particular part of time where you will advise something and they will not be in a position to follow your advice. So then your dynamism will come into play. Then you have to help them. And that is what empathy is. And then you have to be compassionate. I will say that you should be passionate to be compassionate. You should be passionate to be compassionate. This has come to my mind just now. Any one of you can note it down and send me back on WhatsApp. You have to be passionate to be compassionate. You should have the passion to help people. You see, public health is all about helping others. Medicine is all about helping others. Because when you are healing people, you are always giving them something. And help is what? When you give others something. So you have to be compassionate, right? You have to be empathy. You must have empathy and compassion. These are the two words. And you should be sensitive to the needs of the people, of the community, of the family. And only then you will be able to fulfill the requirement of becoming a good doctor. These are all the attributes which I don't say that everybody is born. We'll talk about more when we finish. And then I come to the last slide, probably this is the, again, important. Then you should have a integrity, and you should work with ethics and honesty. Only then you are going to get the respect. Your integrity should never be questioned by anybody. And ethics is you have to do a right thing at right point of time for the people. And you should appear to be honest. You should be honest, but then more important than that is you should appear to be honest. And if you are able to do that, then you are going to get the fourth dimension. What we say is the respect. And I when I started, then I told you that yes, everybody respect a doctor. Nobody disrespect a doctor. Everybody respect a doctor, and a doctor behavior should be in line of that kind of a respect which is getting from the society. And his job or her job is to help the patients, people, and community and society. So it should not be like this that which is happening nowadays. It's more common in both the arena, in the clinical practice as well as in the public health, that you take funds and then you don't utilize them where they are meant to be used. Right? So integrity, ethics, honesty will always give you respect, and that will give you a lifetime satisfaction. That will give you a lifetime satisfaction. So these are all the attributes which are important in line of the functions which a doctor is supposed to do. A lot of people say that we are joining this medicine to earn medicine. I have never seen any doctor dying of hunger, where in this world, 1/3 of the population is still hungry. So that is the situation. That kind of a vision you must have when you are fortunate enough, you are privileged enough to get this kind of an education, and your job is to help others always. And you can help others only when you are strong knowledge-wise, you are strong skill-wise, you are strong money-wise, you are strong spiritually. Right? So you will have to understand this. If you are strong, only then you can help others. If you are weak, then you will be taking help from others. So it is your choice what kind of a person, what kind of a doctor you want to become. You want to become a doctor who is successful in your own eyes or in the eyes of the people with whom you are working, for whom you are going to work. So that is what is required. This kind of education is also needed besides the scientific knowledge which you are getting from the rest of your faculty and teachers and from your books and experiences. Right? So then the last but not the least, a doctor should be down to earth. A doctor should be down to earth. And if a doctor is down to earth, then he'll be still above all. Ultimately, what is important to you, that you have to decide. Whether you need money, you need satisfaction, you need respect. What you want in your life, that will be your purpose of life. But these are the attributes which are required, which are essential for doctors to maintain the image of the doctors in the community. So to conclude, I will say that nobody is born with all the mentioned attributes. Some of us are born with some of the attributes. But all of us have to inculcate all of the attributes gradually over a period of time. It takes time and practice to achieve all this. So, a loving person lives in a loving world, and a hostile person lives in a hostile world. Meaning by that, if you are internally happy, satisfied, then yes, you will be seeing, you would like to see everybody happy and satisfied. And everyone you meet is your mirror. Spiritually, there is no difference. We are all bundle of energies. So keep smiling and keep on pursuing your passion. So with this, we come to the conclusion of this particular topic. And if there are any other questions, you are welcome to ask. You want to say something, then we can stop the live stream. I'm stopping.